Hello, everyone, and welcome to our latest edition of A Few Minutes with Mike. Really good to be with you again, and we have an exciting topic, very timely topic for all of you today, which is on COVID-19 vaccination, something you've been hearing from KidsPeace leadership for some time, and something that's now widely available to all of our associates. So I think the timing is great. I have three really knowledgeable, fantastic guests with me today, two of which you probably recognize and maybe one not as much, but I'm pleased to have with me Dr. Jahre, who's the Senior Vice President in Medical and Academic Affairs, Emeritus Chief of Infectious Disease for St. Luke's University Health Network. And then I also have Dr. Matthew Koval, our Chief Medical Officer for KidsPeace, and Dr. Karan Farrell, our Vice President of Medical Affairs for the KidsPeace Children's Hospital. Welcome to all of you.
Welcome.
So I think everybody is aware that we have sent out a request for questions related to the vaccination and COVID-19, and we're going to address those. But before I get into those questions that were submitted, not only through email, but through a survey that we put out, I thought I would just start with Dr. Jahre and maybe ask you to comment on this question related to the current status, which is, what can you tell us about the availability of vaccine in Pennsylvania and the Lehigh Valley now, amid the news reports that the process has not been as efficient and has led to shortages?
Unfortunately, the news reports are accurate, and currently there is a lot more demand than there is availability. Having said that, we are certainly looking forward that there is going to be an improvement in this in the very near-term future. All accounts are that by the end of March, there should be an extra 240 million doses nationwide. And I think it is quite likely that by July, we'll be able to accommodate everyone in the country who needs the vaccine and wants the vaccine.
Excellent. Dr. Koval, I'll ask you this question, which is KidsPeace conducting vaccination clinics for associates?
Yeah, we are. It was interesting. We sort of went from a vaccine desert to a vaccine oasis very quickly over the span of about 1 week. We had some partners, St. Luke's being one of them, who helped vaccinate some of our associates. We also had the Allentown Health Bureau step forward and vaccinate associates. But then beyond that, we had some interest from Rite Aid Pharmacy and our own outpatient pharmacy, which is Partners Pharmacy. They were able to obtain vaccine, and we've arranged for them to come on at least the Lehigh Valley campuses to actually administer vaccine to our associates. So we were able to vaccinate a total of 140 associates in it's more than that, excuse me. It was more like 220 associates in 3 different vaccine clinics across the Lehigh Valley. They all got their first shot. They will be getting their second shot as scheduled. And we are going to have more vaccine clinics that will be in our associates' workplaces to make it really convenient as soon as we're able to obtain more from the state, which again, Dr. Jahre alluded to, but my understanding is that our Partners Pharmacy will be able to get their hands on some vaccine in the coming weeks, like 2 to 3 weeks.
Excellent. So I'm going to switch to asking questions that were submitted by our associates. So these are the way that they were written and submitted, and I'll direct the first one to Dr. Jahre. One of the big questions asked is, how long does the vaccination work? Will the person whom received the vaccination not be immune, rather less likely to ward off COVID after 90 days?
That is obviously a very good question. And like many questions, it has a tentative answer because remember that the vaccines were released in late December. So a lot of the knowledge that we have right now, we're basically accumulating on the fly. What we do know is this, that if you complete the vaccination series, and currently the 2 vaccines that are available are Pfizer and Moderna, that you have at least 90-day protection. There's actually further evidence that is still being accumulated that would show that it's more like 6 months or even greater. But we can certainly guarantee in nearly all cases 90 days. And again, as we go along with this pandemic, we'll have those answers. But I think the main issue right now is still supply rather than durability. The durability seems to be good. And then the only question is, will it be active against some of the more resistant strains that are starting to come about internationally and nationally? And again, those are answers that we are all eager to hear, and we'll know that shortly. But I think we can assure people that even in the worst case scenario, it may require a booster at some point in time, and that we'll have adequate weapons for these strains that seem to be emerging.
Okay, so I'm going to stick with you, Dr. Jahre, and this question says, I know that the vaccinated person is protected, but is the vaccinated person also protected, less likely, from transferring COVID to others? Or can the vaccinated person still transfer it to others even though they would be protected themselves?
That was a question that remained out there until very recently. There are now 2 studies that have been released, one from the United Kingdom, the other from Israel, that show that a vaccinated person has much less viral shedding and therefore is far, far less likely to be able to transmit the disease to other people. So I think even though, again, all of these things are emerging and remain for further verification, we can say pretty comfortably that it appears that if you get the vaccine, you're not only going to be protecting yourself, but you're going to be protecting those that are around you. And that's another great reason to avail yourselves of this opportunity when you're able to get that vaccine.
And I want to echo that. We're in a helping profession, and so it's great that we can not only help ourselves but help our colleagues and those in our community. So that's great news. Next question I'll direct to Dr. Farrell. It says, I got the second vaccine and I had no side effects except for a little bit of a sore arm. I want to know that since I did not get a fever and body aches, is my body still making antibodies?
Yes, everyone is hearing a lot about side effects that they're feeling. So I'm getting a lot of questions from people who maybe didn't feel much of anything and they're worried. The easy answer is, yes, you don't need to worry about that. Based upon the efficacy that we know, your body can still be making antibodies even though you're not feeling those symptoms. The sore arm is a local reaction. Many people get that. Up to 90% of people will experience that. The bigger systemic kind of full body responses like the fever and the achiness, lots of people are getting that, much higher than in other vaccines that we're used to, but still 50 to 80% of people have that. So there are plenty of people that don't have that at all, but we're still, in that group that showed that it was 94, 95% effective. So yes, your body is likely still making antibodies. Don't worry.
Good. So you can still hope that you don't feel any side effects. And
exactly.
Okay, we'll go back to Dr. Jahre and with, I've heard that some of the most common fears about the vaccine are related to concerns of long-term effects, specifically neurological and fertility issues. I don't know how valid those concerns are, but what do the medical professionals think?
There is very good evidence that would dispel both of those, and one of them is actually mythical. In terms of long-term side effects, we know that with our experience with prior vaccines, almost all side effects that are major would show up within 2 months after getting the vaccine. So clearly we not only have that experience that has now been rolled out to millions and millions of people around, not only around the country, but internationally, but we also have many, many more months now under our belt. So there is no reason at this point in time that we would suspect that there are any kind of major long-term side effects that are associated with the vaccine. That's very different than actually getting COVID-19, where there are absolutely long-term side effects in many people. including people who have minor disease or even asymptomatic disease. So again, when you look at the benefits versus the hazards, there is absolutely no balance over there. The benefit outweighs any hazard. Get that vaccine. In terms of infertility, there was something that went viral on the internet that kind of said that these vaccines are associated with infertility. Not only is that not true, it is absolutely false. There is absolutely no evidence that infertility is associated with the vaccines. And point of fact, many people have become not only have become pregnant while they're on the vaccine without any adverse effect to the developing fetus or baby. Secondly, it also applies to males. So there is no evidence of infertility in either males or females, and I can't stress that enough.
Thank you.
Hey, if I could jump in, Mike, I wanted to point out on what Dr. Jahre said, is not only is there generally not felt to be a risk to a pregnant woman to get the vaccine, there is great risk associated with having COVID while you're pregnant. That puts you in a high-risk group. You're more likely to be hospitalized or have a bad course. And we don't know much at all about how COVID would affect a growing fetus. So again, when you look at risk versus benefit, the side of the vaccine has much more evidence to be safer than the side of actually getting COVID while one would be pregnant.
I totally agree.
And that's a great segue to our next question, which I'll pose to Dr. Jahre and Dr. Farrell, which is, do you have any information regarding pregnant nursing mothers getting the vaccine? I know there were not pregnant women included in the trials for the vaccine, but admittedly, I haven't done much research beyond that. I'd like to eventually get the vaccine, but have been unsure given my pregnancy.
One of the things that we always tell people when they have a specific question regarding their own individual circumstance, they need to check with their private physician, their own physician, in this case, their own obstetrician and gynecologist. So I can answer it in the general. And in the general, again, there is no issue with getting the vaccine and pregnancy. And in point of fact, if I were to look at our own medical staff, what we did is we did a poll of the physicians who currently are pregnant, and virtually all of those individuals have opted to get the vaccine. And that includes one of my infectious disease colleagues who's thankfully pregnant with her first child. She did her own research and came away with the idea that there's no question in her mind. She wanted the vaccine, she got the vaccine, because she felt that to not do so, to Dr. Covet's point, would have put her at much greater risk.
And I'll say it again, just to underline it, the risk of having COVID when you're pregnant, there is an increased risk of severe illness, increased risk of needing to go into the intensive care unit, be ventilated, and death. So that's a very known risk. To the extent that being pregnant is now one of the conditions that raises you in the vaccine priority level. So that's something to certainly weigh. And then the American College of Obstetrics and Gynecology, which is kind of the expert group that looks at all these things, agrees with what we've all said. And they released their first paper, their position statement back in December, and they keep updating it. So it was just updated a few weeks ago. And they are watching this very closely as well, obviously, really being the group that needs to answer to all the people who are pregnant out there. And they are still saying, in fact, that the vaccine should not be denied to anyone who, because of pregnancy, if they want to get it. So.
Great. Thank you. So to our next question, I'll pose this to Dr. Covet. I am the only one of my coworkers who is fully vaccinated. My coworkers are saying that the government is putting tracking devices, and others are saying the vaccines are unsafe. How can I convince my coworkers that the vaccines are safe and no one is tracking us through the vaccines?
Well, first of all, to that associate, I want to say, bless you. Thank you for getting vaccinated. You did the right thing. I think I would certainly encourage you to use what you're hearing today from this panel to help educate folks. I think the fact that you're just modeling, hey, I got the vaccine, and I feel fine and I feel good and I don't have any side effects. I think that really helps encourage people. So I think there's a good number of people who are kind of that, watch and wait and see. And when they see some of their peers getting the vaccine and doing okay, I think that alone could convince them. You could always tell them to come to watch this video, for example, if they have questions. They could reach out to their private doctor, as Dr. Jahre pointed out earlier. You can have mine on my phone, but you can wear your vaccination sticker so you can show people that you've been vaccinated. And again, I just really commend you for even asking that question, because you're not just thinking about yourself, you're thinking about everyone else. And that's really what KidsPeace is all about. So thank you for that.
Excellent. Okay, back to Dr. Jahre. What can you tell people who are concerned about the emergency use authorization and whether vaccine safety has been fully tested?
So that gets back to the first question. And obviously, we have now many months of experience that are beyond the trial that lets us know that there are no issues that have developed that would actually contradict the initial approval, and that was based on good safety data. So nothing has emerged that made us change our mind. I will also tell you that despite some of the things that are on the internet, no one has died of any side effects of the vaccine. So there is nothing that we have in hand that would tell you that there's unsafe issues that are associated with the vaccine. Now, as far as when the FDA will decide that they can lift the emergency use authorization, there are a number of other factors that go into that. The likelihood is it will happen within the next couple of months. And in that type of situation, it also enables the companies to charge for the vaccine. So there's really a downside for that in a much more vigorous fashion than what's been going on recently. So this EUA is nothing unusual. That's what happens with most drugs and certainly most vaccines. And there's every reason to believe that that will be lifted within the next several months on the 2 existing vaccines. And then we have several that are coming out.
Lots of stuff on the internet. That's both a blessing and a curse, isn't it? Okay, Dr. Farrell, we'll go back to you with if someone has had an allergic reaction to vaccines in the past, should they get the COVID shot?
The quick answer is yes. Having an allergic reaction to a past vaccine does not prevent you from being able to get the COVID vaccine. Now, if you had a serious allergic reaction to a COVID vaccine that you already got, that may prevent you. Now, again, that's not all of these reactions that everyone's feeling. Those are not serious allergic reactions. Those are vaccine reactions. Serious allergic reactions occur immediately, like within the few hours after the vaccination. But even if you've had this to past vaccinations, you are still eligible to get the vaccine, and I highly encourage you to do it. The only other things, and these are very rare, that is the latest update from the CDC, is if you have a specific serious allergic reaction to PEG, or polyethylene glycol, or polysorbate, which most people wouldn't even have had the chance of encountering. But if you specifically have an allergy to that, then you should also avoid the COVID-19 vaccinations. But otherwise, get it.
And I believe I'm correct that when anybody is receiving the vaccine, they're going to be asked to wait for 15 minutes after getting the injection, just to ensure that there's not an immediate allergic reaction, correct?
Yes, at least 15 minutes. Some people, they're recommending 30 minutes, depending on their history. And if you have concerns and you are active with an allergist or an immunologist, certainly talk to them about it. They can let you know what they feel like you should, have as far as observation. And some people are even getting them, under observation by medical professionals. But do, speak to your allergist or immunologist, certainly, but everyone will be watched to make sure they don't have an immediate reaction.
Good. Okay, Dr. Koval, can you comment on reports that severe side effects and even death have been reported amongst those who have received the vaccine?
Yeah, and I'm going to try to make this quick because I think Dr. Jahre already alluded to it, as did Dr. Farrell. I guess the way I would look at this, I'm aware of media reports of people who've been vaccinated and then suffered death that day or the next day or something like that. But I guess what I would point out first of all is, let's think about the group of people who are eligible for the vaccine. First, it was healthcare providers, and then it was elderly people with pre-existing conditions. And so those are folks who are vulnerable from their pre-existing conditions. The vaccine is helping them stay clear of COVID, but that's not going to help their heart disease or their high blood pressure or their other diabetes or other health problems they may have. So the key is, there's not been, as Dr. Jahre pointed out, there has not been an association between the vaccination and any form of sudden death or any morbidity associated with getting the vaccine. Even in the cases that we heard of initially of the severe allergic reaction that Dr. Farrell alluded to, and by that we mean sometimes you'll hear the term anaphylaxis, where the person can have trouble breathing and other things. Those have been a very, very small amount of the millions and millions of vaccines that have now been distributed, 46 million in the United States and many more million outside the United States. So it's been a very small handful of people, and it is my understanding, and Dr. Jahre, jump in and help me, but those are generally been well taken care of with either shots of epinephrine or immediate care at the scene, and even those reactions haven't resulted in any morbidity or mortality that I'm aware of.
That's absolutely correct.
Good. Okay. Dr. Jahre, what is the difference in effectiveness between the 2-shot vaccines available now and the 1-shot version under development? Is there a reason to wait for the single-shot version?
As with a lot of things, first of all, the J&J vaccine has been submitted and will be looked at by the FDA on the 26th, and there's every reason at this point in time to believe that they're likely to approve it and be ready to go within about 5 days afterwards, if we were to go by our previous experience with the other vaccines. I think it's a little too early right now to be able to ascribe specific differences because they're studied in a somewhat different way. I think the one thing that we can take away from the J&J vaccine that does seem to be true is that as far as its ability to prevent the most serious complications of the illness and death, it seems to be on par with both the Pfizer and Moderna vaccine. There may be some less effectiveness in preventing some mild or moderate symptoms, but again, I would say that that remains to be seen until it's actually totally vetted by all the panels that need to do so when they look at the data. But the most important thing is, if it gains approval, it looks like it'll be very close to the other 2 vaccines in the most serious complications and death prevention.
And I've heard the saying, if you have access to the vaccine, it's the right vaccine, no matter who manufactured it, right? So
that's right. I mean, as Dr. Levine, who is our former Department of Health, Secretary of the Department of Health, would say, is you get what you get, you don't get upset.
Good. Okay, Dr. Farrell, we'll go back to you with this question, which is, some in the Black and Hispanic communities report reluctance to get the vaccine because of historical discrimination and unethical treatment of people of color in medical research. How do you answer those concerns?
Those issues in history, thankfully, have led to many checks and balances in our modern healthcare system to be sure that nothing like that will ever happen again. A bigger concern in our modern healthcare system is racial and ethnic disparities and making sure that all people of all races and ethnicities have access to the same healthcare. And this extends through the COVID response. There are entire task force studying and releasing data on access to the vaccination to be sure that it is available to all races and ethnicities. And we want to make sure of that. So definitely you will have access to it here through KidsPeace. So I highly encourage you to go ahead and get it. And not only that, we are highly encouraging all races and ethnicities to get it. Now there is some data, and we have a lot more work to do with filling in the holes in the data with regard to race and ethnicity, which hasn't been fully reported through looking at all the COVID data. But the early data shows us that the certain racial and ethnic minorities are at risk of more severe illness. And so therefore, I would say that all people should get it. And, you know, if you're in a population that might get more severe illness, even more of a reason to get it. And hopefully, you know, we can get rid of any disparity in our modern healthcare system and overcome any darkness from the past.
Thank you. Okay, Dr. Koval, this one is for you. Is there an argument for getting the vaccine that addresses the comments from some people, mostly young, that they don't see COVID-19 as a risk to their health, and so they see no reason to get vaccinated, or they have had COVID and therefore they're immune?
Well, that's a complex question. So first of all, having COVID itself, let's address that. Again, our current thinking is your immunity for that, having the natural course of the illness, is at best 90 days. And that's kind of the number that we've been working from. And as Dr. Jahre alluded to earlier, the vaccine is very likely, we know it gives you 90 days, but it's very likely to actually give you protection beyond those 90 days. So that's one thing to consider, to put in the vaccines corner, that the illness itself may not confer enough immunity. The second thing is, you know, it won't really affect me that much, so I don't need to get it. Again, as Dr. Jahre mentioned earlier, there's emerging data that this not only protects you, it protects the people around you. So if you're a strong 20-some-year-old person who doesn't feel like COVID will make them very sick, you may have a vulnerable loved one, you may have a grandparent, you may have a friend or an acquaintance who, simply by you getting the vaccine, you help keep them safe. And I think that's just as important as keeping yourself safe. And then the only other thing that I wanted to, can you tell me the third? There was three parts to that question, and I had another comment.
Is it a risk to their health, and that they see no reason to get vaccinated? Or...
Oh, I remember now, Mike.
Yeah.
I got you. This idea that, well, I haven't really gotten it, so I don't expect to get it. That's kind of like saying, you know, I played on the train tracks 10 times and I never got hit by a train. That doesn't mean the train isn't going to come at some point in the future. So I think that's a risk, given that, gosh, 500,000 people in the United States have died from this illness. I think that is a risk that is not worth taking. And young people with no pre-existing conditions have died from COVID.
Okay. And we'll go back to Dr. Jahre with this question. Are the mRNA vaccines DNA altering to the extent that doctors believe that it will cause a concern for the ability of the body to fight diseases on its own?
No, that's another myth, that the mRNA vaccines don't do anything to alter our DNA. It actually just sends a message to us in order to make antibodies that are appropriate and act against the COVID-19 virus. And that messenger is only present in the body. It's rapidly degraded within a couple of days. So there's nothing permanent about it. There's nothing permanent in any way, shape, or form in terms of its alteration either.
Okay, so we've come to our last question, and I'll pose this to all three of you to chime in as you wish. And it is, we're hearing a lot of things about COVID and the development of the vaccines and treatments. And it seems like there are many differences of opinions about these issues from many different sources. How can we determine what information is factual and science-based and what is not when it comes to the COVID-19 vaccines? Who would like to start? Go ahead. Dr. Jahre, why don't you start?
Okay, well, again, I think you alluded to the fact that there's lots of information that's on the internet that isn't based on fact. There's information that will tell you that the world is flat and that Elvis is still alive, but that doesn't mean that those are, in fact, credible. So the word right now is, where do you get credible information that's based on scientific fact? And there are a number of different places that I would certainly ask our audience to go to. The first is the Center for Disease Control, and that's cdc.gov. There's a very robust website that has to do with specifically many issues in terms of healthcare, but actually a lot of it is devoted right now, and you can punch that in to COVID-19. The FDA, or the Food and Drug Administration, also has a site. In addition, I would also encourage the State Department of Health, and in this case, Pennsylvania State Department of Health. There's also, for those who live in New Jersey, an equally good site. And lastly, if I can give a bit of an advertisement from my own hospital network, we've also developed a very good site that takes into account the information that's coming from all these other places. It gets updated regularly, and so that you could end up going on the St. Luke's site and find FAQs for your questions as far as COVID-19.
Excellent.
I'll jump in after that, because I agree 100% with everything Dr. Jahre just said. He's not aware because he's not a KidsPeace person, but we do operate in a number of different states, about 7 or 8 different states, Dr. Jahre. So they can go to the Department of Health website in their state. In Maine, for example, we have a facility there, and they actually have their own state CDC, and they have a website. So I encourage folks to go to that website, and in those websites in their state for more specific statewide information. But the only other thing I would say is, I guess I would caution anyone that if you find yourself getting your information from only one place, and that's your go-to place, and you don't go anywhere else, it's very likely you're not getting the full picture. And so in addition to going to credible places, which is very important, be willing to open your mind to go to different places and look at different points of view. Because I think that's vitally important to getting the whole and clear picture.
Thank you.
I'll just jump in and add that I think all of those websites are great. The CDC website has so much information on it. Sometimes it's hard to find things. So I think more what people are doing is they're Googling a specific question. And so I would just again say, when you look at your Google results, don't just choose the top one. Glance down the first page, look for the ones that are from the CDC or the Department of Health or large hospital systems or major academic institutions. And then sure, do your research, but read various things that those sources are saying, because I think you'll find that they're all saying the same things. And if we don't know the answer, then they're kind of saying that. And if you go to a website that says something very different than all of those sources, then that's not a good website to look for.
And I will just add that watch for the Dr. Koval tip of the week. He's been putting out fact-based information on this pandemic since the very beginning, and he does a great job with that. And much like St. Luke's, on KidsWeb, we have a page devoted to COVID-19. And again, nothing gets posted there unless it's been vetted and is fact-based and not pulled off the internet or the rumor mill. So that brings our segment to a close, and I want to thank our 3 guests. I think this has been extremely informative. I want to thank our associates for submitting questions. We may very well do another episode like this in the future. And if there are additional questions that any of our associates have, please send them to me, and we will keep track of those and try to get answers to you very quickly. So again, thank you to my guests, and that brings our segment to a close.
Thank you.